My pleasure to introduce our esteemed guests. Dr. Suzette M. McKinney is a public health expert, medical executive, thought leader, strategic thinker, and nationally recognized expert in emergency preparedness and response. She serves as principal and director of life sciences at Sterling Bay, where she leads the strategy to expand their footprint in life sciences nationwide, including laboratory incubation and graduation space. Prior to joining Sterling Bay, Dr. McKinney was CEO and executive director of the Illinois Medical District, IMD, where she managed medical research facilities, labs, a biotech business incubator, universities, 4 hospitals, and more than 40 healthcare-related facilities. Before IMD, Dr. McKinney served as Deputy Commissioner for the Bureau of Public Health Preparedness and Emergency Response at Chicago Department of Health. In 2020, Dr. McKinney was appointed by Illinois Governor Pritzker as operations lead for the state of Illinois' alternate care facilities, a network of alternate medical locations designed to decompress the hospital system during the COVID-19 pandemic. She worked with the U.S. Army Corps of Engineers and multiple construction, architecture, and project management teams to prepare 5 facilities to open for overflow patient care. In her spare time, she hangs out in academia. Dr. McKinney serves as an instructor in the Division of Translational Policy and Leadership Development at Harvard University's T.H. Chan School of Public Health and as adjunct assistant professor of health policy administration at the University of Illinois at Chicago School of Public Health. She was named one of Chicago's 50 most powerful women and one of Chicago's notable women in healthcare. We are thrilled to have you here. Jean Eng is Regional Director of Community Health for Advocate Aurora Health in Northern Illinois. Grounded in health equity, she leads community engagement strategy for Advocate Healthcare hospital service areas in the North Suburban Chicago region, spanning 3 counties, serving more than 1.3 million residents. Jean has extensive experience in outpatient primary care clinic operations, public health, and community health, including with the Lake County Health Department and Community Health Center. And Rafael Malpica is Director of Community and Guest Relations at Advocate Good Shepherd Hospital, right in Barrington's backyard, part of the largest health system in Illinois and 9th largest in the nation. He also serves on the board of Mano a Mano Family Resource Center, empowering immigrant families to become full participants in their community, and El Valor, the first bilingual bicultural rehabilitation center in Illinois. Fittingly, El Valor means courage. Welcome, everyone. With that, it is my great pleasure to introduce my co-host and beloved pastor of the Community Church of Barrington, Reverend Dr. Zena Jacques. Zena.
Thank you, Jess. I'm curious. How many of you had trouble getting a COVID vaccine or a COVID test at the beginning of this whole pandemic? Oh, wow, hands everywhere. You know, it is frustrating when you need something for your health and for your well-being, and all of a sudden it's not available to you. Tonight, we're talking about health equity and inequity. And that experience of wanting that vaccine or that test for you or your loved one is going to put you in the right frame of mind to remember what it was like to not get what you needed. So I want to start with a few definitions to make sure that we're all on the same page. Social determinants of health are the conditions in the environment where people are born, live, work, play, worship, and age. All of those determinants that affect a whole range of health functioning and quality of life outcomes and risks. So those are your social determinants of health, all those things that affect the way you live. And good health begins in the places where we live and work and play. Although medical care is critically important, things like the quality of our schools, affordability and stability of our housing, access to good jobs with fair pay, and your sense of safety in your neighborhood, all of these keep us healthy in the first place. And health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires moving obstacles to health, such as poverty, discrimination, and all of their consequences. Now, there are some factors that contribute to racial disparities during COVID. Some of those factors were not having access to testing. You just felt that in your body. Living in high density areas, being exposed to pollution, having a pre-existing condition, being an essential worker, and racial bias in healthcare. And my friends, if you tell me your zip code, I can, with fair certainty, predict life outcomes, educational outcomes, income outcomes, and life expectancy. Your zip code ought not have that kind of power, not in a nation like this one. So get ready. We're going to learn some things tonight. And it is my honor to introduce our guest, Dr. Suzette McKinney. Suzette, we are in your hands.
Thank you so much. It is so wonderful to be with you all tonight. I have been anticipating this conversation for a very long time, and I just want to start by saying thank you. Thank you for being willing to have a courageous conversation around health equity. I have found that so often these issues are things that people just really don't want to talk about. And so it is very encouraging to see an entire community come together to have the conversation and brainstorm and try and identify ways that you can create meaningful change right in your own community. So again, thank you.
We are excited to have you present. Would you be willing to start with your personal story? How did you come to this work? Why does health equity matter to you?
Sure. Well, I will start by telling you that I've always had a helping personality. I remember wanting to be a doctor, specifically a pediatrician, since I was 5 years old. I loved children, I wanted to help people, and I thought that being a pediatrician would be the perfect career for me. As I progressed through my undergraduate years, I refined that a little bit and decided that I really wanted to help tiny babies and their very worried mothers. And so a specialized pediatrician, a neonatologist, was the way that I wanted to go. But this was also about the same time, and I will say I was a student at Brandeis University, just outside Boston. This was the same time when my interest in public health began to grow, and I decided that before medical school, I would pursue a master's degree in public health and perhaps a year of experience working in the field. I thought that that would give me a greater sense of what was needed on a population level and make me a better clinician. But as I got deeper, after the master's degree and got deeper into my public health work, I became more and more in tune to the narrative here in Chicago that the South Side and the West Sides of the city were the poorest areas of the city, with some of the worst health outcomes in the country. I will tell you, I grew up on the South Side. I went to school on the West Side. And not long after my time at the city of Chicago, I became CEO of the Illinois Medical District, which meant I was now working on the West Side of Chicago. I will also tell you that today I am 48 years old. And that has been the narrative about health and health status on the South and West Sides my entire life. So throughout my career, I have progressively tried to use my platform to do something about it. I have a lot of mottos that I live by, and one of them is, don't talk about it, be about it. So I try to use my work and the platform that my work gives me, no matter where I'm working, to not just talk about all of the problems, but to actually try and do something, whatever I can that's in my own power to create some level of change.
Fabulous. We often think of good health as being earned by our individual healthy behaviors or bad luck when we get sick.
Yeah.
How should we be thinking about this?
Well, you know, I would say to some degree, good health can be earned, if you will, by healthy behavior. I think the best example I could think of, and it's an example from my own family, diabetes runs in my family, and I wanted a better outcome for myself. Having studied public health and worked in public health, I understood that in order to have a better outcome for myself, I have to eat a healthy, balanced diet. I have to incorporate exercise into my life and into my daily routine in order to manage my weight. But a person should not be subject to poor health or poor diabetes outcome, for example, just because the neighborhood that you live in, which is the neighborhood that you can afford to live in, doesn't have a grocery store for you to purchase fresh produce or other quality food, or the community that you live in doesn't have workout facilities that you can go to for exercise, or that the crime is so high in your neighborhood that you don't feel comfortable going outside to exercise. I think in terms of how we should be thinking about this, I think as a society, we should be thinking about how we can come together as business leaders, as legislators, as healthcare leaders, and just concerned citizens to create the type of change that eliminates barriers to basic human needs in communities where they don't exist.
In your work in the city of Chicago, how do you see social determinants of health manifest? Well, you just mentioned obstacles. What are some of those obstacles that you think we could attack to close health disparity gaps?
Sure. Well, you know, I think the first thing I would say when I was with the city of Chicago, and I was there for almost 14 years, and then I went to the medical district, which again sits on the west side and is surrounded by communities with poor health outcomes. I saw the social determinants of health manifest themselves in so many ways. You know, I saw women not have the same level of health care, pregnant women, that they needed in order to have a healthy pregnancy. Or I saw women have worse birth outcomes simply due to the color of their skin. Because believe it or not, you know, there is racism that exists in our healthcare system. And I have heard firsthand accounts of how physicians ignored a woman's complaints, you know, about how she was feeling in her body, symptoms that she was having, you know, writing them off as being normal during pregnancy, only to have the ignoring of those chief complaints result in an outcome that certainly put the mother's life at risk, but the baby's life at risk as well. When I was overseeing emergency preparedness, I saw communities that were at greater risk of slower recovery and less resilience following an emergency or disaster situation like COVID, for example, because their communities didn't have some of the same basic resources that more affluent communities have. You know, I submitted, so first of all, I sent forward the report from the Metropolitan Healthcare Council, not the Metropolitan Healthcare Council, the Metropolitan Planning Council, about the cost of segregation, which really highlighted, you know, how longstanding policies have created these systems where people live in communities where there is no investment, where banks won't give loans, where there are no grocery stores, there are no just other things that other more affluent communities have for their basic human needs. And it's the absence of these things that breed conditions that allow the social determinants of health to manifest. So things like substandard housing, has anyone ever heard of a housing project? I can tell you, when I first came home from college after undergrad and I took a job working in public health, I worked in the Healthy Moms, Healthy Babies program. And I was the last one hired. And so my office gave me the clients that no one else wanted to work with. Those were the clients who lived in the projects and the clients who didn't speak English. And I would go to these buildings, and they no longer exist, but it was the Robert Taylor homes. I'm sure many of you have heard of them. And if you can just imagine a building that was 16 stories high and 16 apartment buildings on each floor. And these were not, the floor plans and the space in each of these apartments and in these buildings in general was not very large. And you would find conditions where not only was the housing stock substandard, but just because of the level of poverty in some of these communities, you had 2 and 3 families living in one apartment because they were putting their money together to afford the one rent. So those are some of the ways that I've seen the social determinants of health manifest. And again, I think in terms of us being able to close some of those gaps, it really starts with some of these longstanding policies that we've seen.
You mentioned COVID in your last answer. I'm curious, how has this pandemic period informed your thinking about improving the quality of life and care for everybody?
Yeah, I would say, first of all, I've always felt, and I continue to believe, that true substantive change takes all of us. For those of us that are trained in public health, we call it a systems approach. So you may have seen in that MPC report again, all of these generational policies and practices that have set up these barricades in and around Chicago that have led to this being a region where people from different races and different incomes live so separately from one another, But I think we all deserve an opportunity to earn a living. I think we all deserve to live a certain quality of life, and we all deserve to have fair and equitable healthcare. And to be honest with you, our economy is better off when more of us have the opportunity to participate in it. So, equity around employment and equity around education, in my opinion, are equally as important, because those are the things that lead to opportunities to participate in the economy. Something that I wanted to read from this report that I just thought was so poignant. On page 3 of the report, it says, economic and racial segregation has strangled opportunities for millions of people. Now, this is specific to the Chicagoland area. We're not talking about other parts of the country. Disinvestment has devastated entire city neighborhoods and suburban villages, towns, and cities. Lack of diversity also hurts affluent communities, where limited housing options often mean that young people cannot afford to return when starting their own families. Retirees cannot afford to stay, and valued employees are priced out. And so, I think it's some of these very conditions that we saw with COVID, lack of access to testing, lack of access to the vaccine and other resources. I think that's a part of the reason why we saw it play out so much with COVID. And so, I believe that as a society, we have to actively practice what my good friend Connie Lindsay from Northern Trust Bank calls the JEDI approach. And that is, in everything we do, we have to infuse justice, equity, diversity, and inclusion, JEDI. And what I believe that means for us, especially post-COVID, we have to actively pursue diversity in the workforce, in the C-suite, and even in the boardroom. Because whether you believe it or not, diversity breeds new and innovative ideas, and it gives us all an opportunity to see issues and challenges through varying lenses that then give us new perspectives. And that interaction alone begins to breed the type of change that we need. So again, I think it'll take all of us, policymakers, lawmakers, all of us, to begin to break down some of these long-standing restrictive policies that can lead us to change.
I want to push a little more on that, because in this series, we talk a lot about being woven together in a national and a regional, local tapestry. You've just said it takes all of us with a JEDI approach. Yeah, the city, the suburbs, Black and white, young and everybody.
Yeah.
Dr. McKinney, how do we do this? How do we jumpstart this? Does the pandemic help us? Does it open awareness, or what are our next steps?
Well, I certainly think that the pandemic has raised awareness. And I think many of us will, sort of take these issues that the pandemic has taught us or has shown us and begin to move forward. But let me give you some specific examples of how we can create change. I think you have a slide that I submitted, and I just want to show you something. And this came from, yes, that's it. This came from work that I was involved in at the Illinois Medical District when I was CEO there. So what you are seeing is a depiction of life expectancy gaps on the west side of Chicago, displayed through the lens of the CTA L station, L system. So the colored lines represent the rail lines that run throughout the city of Chicago. So I want you to look at the green line. Right in the middle of the graph, there is a yellow box that says West Garfield Park, and it has the number 69. West Garfield Park is a community on the west side of Chicago. 69 is the life expectancy in West Garfield Park. There's no need to say, but I will. West Garfield Park is a predominantly African American community. If you look 3 white dots to the right, those white dots represent the stops where the train stops. 3 white dots to the right of the slide represents the train traveling east to the loop. Do you see what that number is? 85. A 16-year difference in life expectancy if you live in downtown Chicago versus the west side of Chicago. That is the best example that I can show you of zip code determining how long you live. So what we did, and this work, first of all, I have to give credit. This slide was created by Rush University Medical Center. The life expectancy findings by neighborhood were determined and identified, I believe it was 2016 when Rush University Medical Center conducted their community needs assessment. And Rush really took the lead to galvanize all of the anchor institutions in the medical district and community organizations on the west side and lots of other stakeholders from across the city. You can take the slide down now, thank you. And what we wanted to do was come together in a way that could create some meaningful change. And the last thing we wanted to do, and we wanted to really avoid this at all costs, was go into these communities and tell them what they needed, as opposed to working with them and asking them what they thought they needed.
Mhm.
So when we went into these communities, it was addressing the social determinants of health, job creation, economic growth and development, better housing, better neighborhood infrastructure. And so as an anchor institution, the medical district itself, the other 4 hospitals that were located in the district, we started with looking at our own internal policies and figuring out what could we do within our own institutions to address some of these social determinants. And I love one of the things that Rush did. They realized that all of their entry-level positions were the slowest level, had the slowest level of turnover. In other words, when people got hired into entry-level positions at the hospital, they stayed in those positions and they never left. Well, it was because they didn't have the education or the skill level to be promoted up within the organization.
Mhm.
So Rush partnered with the university, created a curriculum with this university to allow their entry-level employees to go through additional educational training that would provide them with the skills they needed to move up in the organization. So when they vacated those entry-level positions, Rush only hired into those positions from the west side of Chicago. That's how you create change.
Yeah.
You do what you can within your own community, organization, or even yourself as an individual, whether it's through volunteerism or philanthropy or whatever it is that you can do. You do what you can do to make a difference. And if enough of us do that, we'll begin to see the change happen.
The chaplain at Rush recognized that pastors were in terrible physical shape. And they created a program where they invited 18 of us to come and get Weller. That was the name of the program, Weller. And my colleagues across Chicago, I was one of the few from the suburbs, it was mostly in the city. We see each other and ask, are you Weller? And Rush poured into us so that we could go back into our congregations and carry the message. V. Allen Ragland from Third Baptist was the strongest proponent of this program. So you're right, they made a difference in our lives, and I pray we've done that too. So my next question is, you've told us what we can do. You've given us some marvelous examples.
Yeah.
What's at stake if we sit on our hands and don't prioritize health equity? What's at stake if we sit still and do nothing?
I think if we sit still and do nothing, all of these issues, challenges, and problems will continue to persist, and they'll begin to bleed into other communities. You know, I think about crime and I think about violence. You know, Americans, I say this all the time, as an American, we're so complacent. You know, something like COVID happens, it affects all of us, it impacts all of us, and we're so concerned in that moment. But as soon as it goes away, we go back to doing what we're doing and we forget about it, you know? I think about, and I will ask all of you, how many times have you watched the news and you heard something about, let's just say, a shooting? And the person that the news reporter interviews says, I'm so surprised that happened in this neighborhood. Why? Why are you surprised? Because as long as we ignore issues of inequity, that's what breeds crime. You know, I think about Arne Duncan. When he left the White House as Secretary of Education, he came back to Chicago. He got some funding from the widow of Steve Jobs to do some work with inner city youth. And he went into all of these poor neighborhoods and he said to these young men on the street corners, what would it take for you to put that gun down and do something productive with your life? And they all said, I need a job so I can take care of my family. I'm out here selling drugs and being involved in gang activity, because that's how I make money to support my family. And so we sit on our hands and we do nothing. The issues persist, they overtake the city. And when there's nothing else left to be taken in the city, guess where they're going? The
So
suburban areas.
I have a favorite question. What's the thing you worry about, and what's the thing that brings you hope?
Well, in the context of this conversation,
Mhm.
I worry about us being complacent.
Mm.
Because just with COVID, I have been so encouraged
Mm.
by a lot of what I saw in the very beginning, where business leaders, philanthropists, community organizers, like we all came together to do things like donate food to people who couldn't get out and just get food. And I thought, gee, if we could do that regularly, when something like COVID happens, maybe we wouldn't have so much of those issues. But I worry that we will forget once COVID is over and we will all go back to our comfortable lives. And all of those people who were suffering before COVID and suffered even worse during COVID will continue to suffer. What gives me hope is the younger generation. I have a 19-year-old daughter. She just finished her second year of college, and I watch her. I watch her friends, and I watch these young people that I see in the media and even on social media. I feel like I had to get on social media when my daughter was in high school so I can make sure she was following my rules. But young people are out there. They're on the front lines. They're trying to create change. And I think that while many of us may not be comfortable with how they're doing it, I have to tell you, last summer when my daughter wanted to go downtown to a protest, I was scared out of my mind. But I felt like I had to let her go. So I let her go. But guess what? I sat in my car for 6 hours, in the South Loop, waiting for her to call me in case something happened. But I had to let her go, see for herself, and be involved in a way that at least she thought she wanted to be involved. Now, afterwards, it was a bit too much for her, but I had to allow her to have that experience so that she could figure out how to express her activism. My daughter figured out hers is not out protesting in the street. Instead, it's writing and bringing awareness and, more civic minded activism. But I'm very encouraged by what I'm seeing in the younger generation.
Dr. McKinney, you have inspired us. You are a Jedi in every conceivable way. We thank you for your wisdom, for your challenge, and for your hope. You are a blessing to us this evening. Thank you so much.
Thank
Folks, give a thumbs up or clap we appreciate you deeply. Jess, the mic's in your hands.
Thank you so much, Zena and Dr. McKinney. I mean, the statistics that you just threw up there, it's so powerful, and it makes me think a little bit more. That's Chicago. That's what Chicago's dealing with. I'd love to focus now on what our Northwest suburbs are seeing on this same topic. And so I would love to welcome Jean Eng and Raphael Malpica from Advocate Aurora. And we are going to start off with the question thrown out to both of you. How has awareness about health equity shifted over your career? You each have been in this work for a really long time and have a lot of experience. Tell us a little bit about what you've seen change over your career.
Well, I think I'll jump in. I've really had the blessing of seeing some of this change firsthand in my career. I started working in 2001 in healthcare. having worked prior to that in a variety of roles in social services, et cetera. But I jumped right into healthcare and actually did a lot of work in a federally qualified health center and ended up working there for 14 years and in the end really operating and being the director. But one of the things that we worked on as our mission was creating access to care for underserved. So for our mission in FQHCs is, uninsured and underinsured, and making sure that they can have access to primary care. And I will tell you, in all of those years of work, I saw that a lot of the health outcomes that Dr. McKinney was talking about really didn't move. A lot of our patients continued to have diabetes and high A1Cs and a lot of high obesity rates. A lot of the health indicators did not change. And I kept wondering, even though we were trying so hard internally in our system, in our clinics, and in the way that we handled all of our operations in the four walls, why aren't things changing? Then I transitioned into the role that I'm in now, working in the field of community health and public health, and really changed my focus, changed my perspective, and started really reading the literature, really understanding what community health is and what influences health and its social determinants. And we were not working on any of that. And so now I'm really excited to see the work moving forward that we're doing in Advocate Good Shepherd and Advocate Aurora Health, investing in and digging in to housing, education initiatives, workforce development, things like that. So I personally saw that transition and now get in the actual community and do the work that needs to be done that I think will make change.
I'll just give a little bit of perspective from a previous role that I had. So before I was with Advocate Good Shepherd Hospital and Advocate Aurora Health, I was with Walgreens corporate headquarters. And when I started my career there, we were doing a lot of work in things like, for example, giving free flu shots, which of course, folks need. But towards the end of my career there, when I was about to switch over to Good Shepherd, we started working on food deserts and kind of getting to the core of not necessarily just fixing the health, but why was that happening, and getting to that leading indicator, that what was happening that was giving folks higher A1Cs, more diabetes, more hypertension, the fact that they weren't able to get access to fresh, healthy foods. So that I definitely have also seen the change in organizations looking as to not only what's currently happening, but why is it happening? And those are the social determinants of health.
Just to kind of wrap that up too, I think one of the exciting things is that Advocate Aurora Health and other large hospital and health systems have all now made that change. They have an increased awareness of social determinants of health and its impact. They are understanding the importance of integrated care, whole person care, making food security assessments part of the standard assessment that you do when you see a patient come into the waiting or into the clinic room, and you do assessments around their diet, but you also talk to them about, do you have access to healthy food in your neighborhood? So going beyond some of the standard clinical questions, all of these changes are becoming much more part of the fabric of the overall healthcare system in general, which I think is a huge step in the right direction.
Thank you. Dr. McKinney talked about how what happens in Chicago can have consequences in the suburbs as well. And it's kind of like it just keeps expanding. Can you share with us any examples of this from your experience in community health, and maybe drill down a little bit for those of us who are local about this area in particular?
Yes, I think there is no better example, because it is something that we're living in, than COVID-19. And I'll just give you a brief example. as you've heard, the pandemic and COVID-19 has hit Latinos and African Americans harder than others. And I'll give you a local example: Lake County. In Lake County, the Latino population makes only about 22% of the population. At one time, 40% of almost 40% of the cases of COVID-19 were Latino. That's a huge disparity, and those are the types of things that we're looking at. And when you look at why, you're looking at social determinants of health. Why was it that it was impacting Latinos? It was impacting Latinos because it was impacting the economy. And perhaps you're living in a multi-generational home where you had 3 age warners. 2 of those now lost their job, and there's only 1 person that can work. That's that essential worker going to a manufacturing job that had to go, because if they didn't go, nobody ate, they lost their homes. So I think I saw one of my colleagues on the call, Marisol Lazaro. Her and I built a program at the hospital where we were rounding on COVID-19 patients that only spoke Spanish, and having clinical staff that spoke Spanish to them. And she told me of at least 2 to 3 situations where we had patients that were on ventilators. As soon as they were coming out of ventilators, what was the first question they asked? When can I go back to work? And when can I go back to work? Because I need to support my family. So it's a real issue here. And I'm just going to give you some statistics to drive it home. So if you live in Barrington right now, your life expectancy right now is about 83 years old. Drive 15 minutes to Island Lake, it drops by 6 years. You're talking about a 15-minute car ride. You go to Carpentersville, go to Sunny Hill Elementary. I think I saw Dr. Almendarez. It drops from 83 to about 78. These are real issues that are not something that we're just talking about in Chicago and faraway places, but something that's impacting us here.
I think going back a little bit to what Dr. McKinney was saying about community safety, one project that I've been working with for the past year, I think is a good example of this. At Advocate Christ Hospital in the city, we started a trauma recovery center a few years ago. And that was really to address the high incidences coming into our emergency department of individuals suffering intentional trauma. That's gunshots, stabbings, domestic violence, sexual assault, all of those, high crime areas, but all the patients being served and not getting access to ongoing care afterward. These are all tremendously traumatic events that need ongoing therapy and support to recover. So individuals and families we built this trauma recovery center in the city to really address this need. Well, as we started looking, I do the community health needs assessment reports and assessments every 3 years as part of my role. And as we started looking at the same crime data up in the northwest suburbs, we actually found that some of the rates were higher than in some of those communities in the city of Chicago. And so I went back to our funder in the next round of funding, and actually we were successful in getting additional funding to open a north branch of the Trauma Recovery Center, which we've just opened in Gurnee, and it covers the whole north region. So it's Lake County, McHenry County, Kane County, and Kendall. So the same issues of violence are here in our communities we're living in. The same individuals, there are rising rates of domestic violence, rising rates of human trafficking in Lake and McHenry County. It's a big issue we're working on with numerous community agencies. But we have to we have to look at the data. We have to make sure that we're not making assumptions that, oh, that just happens in the city. These are the same social determinants that are influencing the crimes in the northwest suburbs that are in the city. Lack of opportunity, lack of education, lack of jobs, lack of hope, frankly, in many of these communities. And so I think part of what you can do is address these by looking at data, but also not making assumptions just because we're in the suburbs. These problems exist in the suburbs as well as the city.
Those examples are just mind-blowing to me. And it's so nice to understand what is going on right here and to contextualize that a little bit more. Raphael, I was moved by the life expectancy differential for a 15-minute car ride away. What can those of us do who have the longer life expectancy? Dr. McKinney said, don't talk about it, be about it. What are the things that we can lean into as a community to help change those social determinants?
Sure.
And, sorry, this is a two-part question. And can you also give us more examples? You gave us some great examples of what Advocate is doing right now, but are there any other examples you can give us of how you're leaning into conversations about equity that we might be able to learn from?
Sure. So I'll give you first examples of what we're doing, and then I'll give you 3 things that I think we all can do. Number one, so examples of what we're doing in health equity. So for example, Advocate Good Shepherd partnered with Pioneer Center and supported them on opening the very first homeless shelter in McHenry County. Things like that are things that we're going to continue working on because we know there's a huge need. And actually what we were trying to do prior to COVID was open a kitchen within the homeless shelter, not only so that we could provide people with, with food and a warm meal, but we could also teach them how do you create a nutritious, sustaining, good meal, warm meal for your family in a budget once you're back up on your feet. And in fact, we work with them a little bit more because we saw an issue during the pandemic of folks that were homeless, but also had COVID, and they couldn't come into a homeless shelter. So we created programs to try to provide respite with them at certain motels and hotels where they could stay at least for a quarantine period before they could join, the facilities. As far as what you can do, I'll give you 3 things. Number one, be informed. I think what we are providing you here are a few details. I will give Jeannie and her team an incredible applause because every 2 to 3 years they give you a community health needs assessment for the Advocate Good Shepherd Hospital service area. And most of you watching here are in that service area, and you can see exactly what the social determinants of health are in our area. So be informed. Be informed, and as a leader, make sure that you're pushing for those things in the areas where you lead. And I'll give you an example of something you can do. This is the second thing you can do. In places where you're a leader, push for different points of view and to include different people. And I'll give you an example from one of the boards I'm in that I think some of you have also been in. I'm on the Harper College Foundation board. And one of the things that I'm now the vice president for the board of directors. I'm trying to include more and more folks. And one of the things I said is we give a lot of scholarships to students of color. However, when they're looking out at the folks who are giving those scholarships, they're not seeing themselves a lot of the times. So how about we increase people of color, women, and others in our own foundation board, so that when I look as a brown student out there, I can see somebody who looks, talks, and acts like me. And then finally, I think we can push our leaders to perhaps also be more vulnerable and give us the courage to say, I am at fault of that too. And I'll give you an example. Our own CEO, Jim Skogsberg, has done what we are calling real talks with our chief diversity officer. And those real talks are really talking about those things that are happening right now. And one of the things that he admitted during those real talks was, listen, I was born and raised into a family and a culture where I was told that I was not to see color. I was to treat everybody the same, and I don't see color, I don't see differences. And our chief diversity officer said, thank you for that vulnerability, but what you need to start thinking about now is, I see color, I see difference, and rather than hesitate against that, embrace it. Embrace that diversity, embrace that difference, and turn it into curiosity. And it could be as simple as a curiosity of something that I love. I meet somebody that's not like me. I'm like, what do you eat? What kind of food do you make at home? But turn that into curiosity. So yourself, not to shy away from how you grew up and the things that can be shortcomings, but to turn turn that into something like curiosity that can help us individually move those social determinants of health.
Raphael, first of all, I know what Jean ate for dinner tonight because we talked about it before we started. So Jean, I'm excited about your fresh ham and beans meal. But I think that's a really great point. You know, it's just an easy starting point to be curious about someone who is different than yourself. But I also think your story about the Latinx community and what that community is facing and why when they, you know, get well again, they want to know when they can go back to work. I mean, that's an experience that I don't personally have. And to be able to put myself in those shoes of another really helps to inform, you know, how someone's approaching COVID-19 or why someone might not want to send their child to school because they can't afford to get sick because they need to work. You know, those are great examples of being able to listen to stories to inform different perspectives, therefore different decision making. So thank you for bringing that. Jean, before we end, do you want to give some advice to us about what you're leaning into with regards to conversations about equity and some things that we can do ourselves and within our own spheres of influence?
Well, I think just kind of going along with a lot of what Raphael said, I think that we have to be vulnerable, we have to be uncomfortable. I love what we have been doing in our organization and at Advocate Oral Health, where we have real talks and courageous conversation sessions as employees with each other about race, about inequity. They're open and they're uncomfortable and they're supposed to be. So I think that's important. I also think in our spheres of influence, many of us are on boards. I sit on the board of a foundation in Lake County Community Foundation as well. I'm also the grants chair. And one of the things I'm most proud of is that we've worked with the foundation staff and really led by the foundation staff to change the way we give grants. We really stepped back and realized that we were not being as open and accessible to some of the small nonprofit organizations who can't afford to consult, to hire a consultant grant writer to write a grant application. Some are fledgling and just starting out, but doing really, really good work and good work that needed to be funded and grown during the COVID epidemic, particularly. And so we changed our whole approach to how we accepted applications. We now give preference to those who have board members of color. We ask about their equity programs and what training they have for within their own organization. So we're really raising a lot more awareness and importance and really making health equity front and center in what we want to fund in the Lake County Community Foundation, which as a board member, I'm super proud to be part of. And I think investment like Advocate Aurora is doing as well. We are making investments through CDFIs, community investment funding to affordable housing, into the violence prevention work and the violence treatment work I talked about. We're putting our dollars in the communities with the lowest life expectancy. We're doing targeted funding to make sure that we can change those zip codes. You're not going to change those health outcomes until you change the lives of those in those zip codes. And you do that through investment in some of these social determinants of health.
Thank you so much, Jean and Raphael, for your wisdom tonight. I could talk to you all night long, and I definitely want to have a follow-up podcast so we can continue going deeper about how we are shifting the needle within our own communities here on health equity. Thank you so much for being with us tonight. And thank you also to Dr. McKinney. It's just so wonderful to be able to close our season with all of your wisdom. Thank you so much.
Thank you.
And applause for our guests, a Zoom applause. So we are going to take a short 5-minute pause before we move into breakout dialogues. Listen for the music to end, to come back together. Please come back. We've got lots to talk about and to think about together.
you knew that you would die today, you saw the face of God and love, would you change? Would you change? If you knew that love can't break your heart, when you're down so low you cannot fall, would you change? Would you change? How bad, how good does it need to get? How many losses, how much regret? What chain reaction would cause an effect? Makes you turn around, makes you try to explain, makes you forgive and forget, makes you change, makes you change. If you knew that you would be alone, knowing right, being wrong, would you change? Would you change? If you knew that you would find a truth that brings a pain that can't be soothed, would you change? Would you change? How bad, how good does it need to get? How many losses, how much regret? What chain reaction would cause an effect? Makes you turn around, makes you try to explain, makes you forgive and forget, makes you change. Makes you change. Are you so upright you can't be bent if it comes to blows? Are you so sure you won't be crawling? If not for the good, why risk falling? Why risk falling? If everything you think you know makes your life unbearable, would you change? Would you change? If you'd broken every rule and vow, and hard times come to bring you down, would you change? Would you change? If you knew that you would die today, if you saw the face of God and love, would you change? Would you change? Would you change? Would you change? If you saw the face of God and love, if you saw the face of God and love, would you change? Would you change?
Welcome back, everyone. Before we get started, I just wanted to give a huge shout out to our facilitator core. who have held space for all of us to discuss and go deeper in our breakout groups throughout this entire year. Thank you so much. Again, a huge round of applause, a Zoom applause, a silent one, but it's loud on the inside. Thank you to our facilitator core. All right, so now we are going to move back into our breakout, into our discussion groups. To join a breakout room, sit tight, and our awesome tech producer, JP, will move us all and then move us back together to share out with the full group in the end. Here are the questions that we are going to discuss in breakout. And the first question will be 15 minutes. How does health inequity show up in your life? On a health equity spectrum from excellent to poor, where are you? What social determinants are working for you or against you? The second question is, when you look around at your community, what is one social determinant you can see that could be improved to reduce health disparities? And our final question, if you could use your superhero powers to tackle one health inequity, where would you begin and how? Okay, as always in our dialogues, we hold our 6 grounding virtues from On Being Civil Conversations and Social Healing Project, and they are generous listening, humility, patience, hospitality, adventurous civility, and that words matter. Thank you so much. Have great conversations, and we'll see you on the other side.